Kenya's healthcare industry has a long history of a deep and meaningful partnership between state and non-state actors. These relationships have extended the reach of essential quality health services to Kenyans, especially in hard-to-reach areas. And more recently, the government has partnered with the private sector to equip public hospitals across all 47 counties, availing access to specialized medical treatment that was previously inaccessible to many. Indeed, as has also been noted by previous speakers, healthy citizens are an integral part of building healthy and robust economies. The economic gains that Kenya has made over the past few years can only be sustained if our population is healthy and the healthcare costs are affordable. And it is for this reason that my administration has prioritized the attainment of universal health coverage as a strategic intervention for our envisioned social-economic transformation. We did launch the pilot in December of 2018 in 4 of our 47 counties. And from what we have seen over that period in those 4 counties, we have seen increased access of essential medicines and medical services to excess of 3.2 million Kenyans. The national rollout of the program to the remaining 43 counties and by extension to every Kenyan is on course to improve access to quality health care within their respective jurisdictions. And I think the sustained commitment of resources towards health, averaging 30% of county budgets, has seen an increased recruitment of healthcare workers and availability of essential medicines and other medical commodities. I recognize that we still have a very long way to go. Today, more than 10,000 Kenyans travel abroad annually in pursuit of medical treatment, spending at least 10 billion Kenya shillings. Cancer patients make up more than 50% of Kenyans going for medical treatment overseas. Indeed, across the continent, Africa spends approximately 380 billion shillings, or 3.8 billion US dollars annually in search of healthcare overseas, predominantly India, Thailand, and the Middle East. I believe that Kenya is strategically positioned to serve as a medical tourism hub for our sub-region. Indeed, our own private hospitals have been attending to patients from Uganda, Rwanda, Burundi, DR Congo, Tanzania, Ethiopia, South Sudan, Nigeria, and Kenya remains a pioneer, both by way of policy and by the advancement in medical technologies. And now, more than ever, I believe we must converge as stakeholders to see how we can improve the quality of our healthcare. As demonstrated by what we have seen so far in the expo that is out there, innovative models of partnership between the public and private sectors can significantly improve Kenya's health outcomes while providing insights for others in the developing world. A sustained focus on healthcare excellence in Kenya is therefore crucial, not only for our nation, but for the world at large. Kenya's position as a regional resource for high-quality care is a huge advantage, and I believe we can leverage this even further. As our battle against infectious diseases and threats like coronavirus have shown, collective efforts can make miracles happen, underlying the importance of multifaceted intersectoral collaboration between various partners to achieve the shared goal of health for all. Furthermore, investments in the health sector must also be complemented with cross-sectoral investments in education, nutrition, hygiene, social protection, which yield compounding benefits on healthy societies. I therefore call on all the non-state actors, our private sector, including medical service providers, insurance companies, and financing institutions, to join hands with us in pooling of resources that will extend the reach of quality medical services across our country. We have reason to believe that the world is now, much more than ever before, looking up to Kenya. We, as a country, must now aim to become a serious healthcare provider. The march to quality health cannot be delayed. It is the key to sustaining a success story in the long run. To transform the ideas emerging out of the Healthcare Convention into reality, I believe all stakeholders here need to make collective efforts towards achieving good health for all. And I urge all participants present to make it your mission as individuals and collectively to infuse in all a passion